All right, everyone, welcome. If the AKT exam is looming, then you are in exactly the right place. Today, we're going to tackle a huge, high-yield topic that is an absolute gift for scoring marks, the UKMEC guidelines for contraception. We're going to break this down into a really solid revision tool. So you ready? Let's get into it.
So picture the scene. You're in your clinic. A patient with a kind of complicated medical history sits down and asks about contraception. What's the safest choice? This isn't just a day-to-day question, is it? It's a classic AKT-style problem. And the UKMEC guidelines? Well, they're your key to nailing the answer with confidence every single time.
So to get you exam ready, here's our game plan. First, we'll decode what the UKMEC even is. Then, we'll get into the 4 core categories. And seriously, this bit is absolutely non-negotiable for the exam. From there, it's onto the key rules. Then we'll test ourselves with some high-yield scenarios. And finally, we'll pull it all together. Let's do it.
Right then, let's kick off with the absolute basics. What exactly are these guidelines that we're talking about? And just as importantly, what are they not? So let's be super clear. The UKMEC is an evidence-based tool for us, the clinicians. Its entire reason for being is to answer one simple question. Can this person use this method safely? That word safely is everything. It's the absolute key to understanding how these guidelines work.
And that brings us to what it's not. It's not going to tell you what the best or most effective method is. It doesn't deal with things like drug interactions that might mess with efficacy. It's not a leaflet for patients, and it's not designed for non-contraceptive uses, like using a Mirena for heavy bleeding. And most importantly, never forget, it's a guide, not a replacement for your own clinical brain. Okay, now listen up, because this next bit is the absolute heart of it. This is non-negotiable for your AKT prep. If you only remember one slide from this entire explainer, make it this one. You've got to know these 4 categories inside and out.
So here they are, your new best friends. UKMEC 1, it's a green light. No restrictions, go for it. UKMEC 2, the advantages generally outweigh the risks. This is your proceed but with caution zone. UKMEC 3, okay, now the risks are probably outweighing the benefits. Use is not usually recommended, and you should probably be thinking about getting an expert opinion. And UKMEC 4, unacceptable health risk. It's a hard stop. The method is contraindicated. And to really make this stick, I want you to think of it as a risk escalator. UKMEC 1, you're on the ground floor, go right ahead. UKMEC 2, you're stepping on, you're going up a level. So just be mindful. UKMEC 3, you're getting pretty high now. It's time to pause and think about getting off. And UKMEC 4, you're right at the top. It's a definite hard stop.
Okay, so we've got the foundation solid. Now let's build on it. Let's get into the more nuanced rules of application. Honestly, mastering these little details is where you can really shine, both in the exam and in your day-to-day practice. First up, this is a really crucial difference. Initiation versus continuation. They are not the same thing. Look at this example. A patient with a history of a stroke wants to start the POP. That's a UKMEC2. But if a patient has a stroke while they're already on the POP, continuing it becomes a UKMEC3. The timing, the context, it changes everything. Next is the idea of cumulative risk. I like to call this when 2 + 2 might equal 3. This is a classic exam trap. So your patient wants the combined pill. They've got inflammatory bowel disease, that's a UKMEC2 because of VTE risk, and their BMI is 32, which is also a UKMEC2 for VTE risk. The thing is, both of these conditions are piling on the same underlying risk, so together, that combined risk might just be enough to tip the scales into a UKMEC3 situation. This is where your clinical judgment is so important. And a few more quick rules to lock in your memory. Just like with Category 2s, having multiple UKEMC3s can stack up to an unacceptable risk. And when the guidelines talk about multiple risk factors for VTE or cardiovascular disease, what do they actually mean? It's simple, having more than one. And finally, remember, these recommendations are for contraception only. All right, theory's over. Time to actually apply this stuff. Let's run through a couple of rapid-fire, high-yield scenarios that are absolute bread and butter for the AKT and for your daily clinic. First up, the absolute classic, a patient who smokes and wants combined hormonal contraception. You are pretty much guaranteed to see this, so let's get it straight. Okay, pay really close attention to how the risk changes here. For a smoker who's under 35, the combined pill is a UKMEC2. But look what happens the moment they turn 35. it immediately jumps to a UKMX 3, even if they're a light smoker. And if they're 35 or older and smoking 15 or more a day, that's a straight-up UKMEC 4, a hard contraindication. You absolutely have to know these cutoffs.
Next up, another scenario you'll see all the time, managing contraception for a patient with a high BMI. Now, this is a brilliant example of how different methods have completely different risk profiles for the same condition. Take a look at the injectable, the depot. For a BMI between 30 and about 35, it's a UKMC1, totally fine. But for the very same patient, the combined pill is already a UKMC2 because of that VTE risk. Then, as soon as the BMI hits 35, the depot becomes a UKMC2, while the combined pill escalates to a UKMC3. Knowing these differences is absolutely vital. So let's bring on this home. We've gone from the theory to the scenarios, but the real goal here is to translate this exam knowledge into what we all want to deliver: excellent, safe, patient-centered care.
All right, this is it, your final revision checklist, the absolute must-knows. First, UKMEC is all about safety, not effectiveness. Second, those 4 categories are your bedrock. 1 is go, 2 is caution, 3 is stop, 4 is hard stop. Third, always be on the lookout for those cumulative risks when multiple UKMEC2s stack up. Fourth, always differentiate between starting a method and continuing one. And finally, know those high-yield scenarios cold: smoking, BMI, and VTE risk.
And I want to leave you with this quote from the guidelines themselves, because after all the numbers, the categories, and the rules, this is what it all comes down to. Our job is to use the UKMEC to define the safe options. And once we've done that, the patient gets to make an informed choice that works for them. That's the heart of shared decision-making. Now, we've covered the absolute key highlights today, but for a true deep dive, I really encourage you to consult the full guidelines from the COSRH. Best of luck with your revision. Go and smash that AKT. We'll see you on the next explainer.